Morning, doctor.
Hi, good morning. My name is Z. I'm with House Herbal Solution, Herbal Medicine Clinic. And today I'm going to introduce another interesting case. It's about painful menstruation, which is very common to many young female or mid-age females. So this young lady is about 30-year-old, and she recently have a very painful menstruation. And every time she had the menstruation, she feel nauseous. She would even throw up, and she would have a lot of diarrhea. The lower abdomen would be so painful that it is becoming unbearable. So there will be a day that she totally couldn't function.
That's happened to a lot of young women.
That's right. Yes, and also the flow become very light, like almost like nothing. And
only 30-year-old.
Yes, about 30-year-old. Yes.
Okay.
Other symptoms include constipation and frequent urination.
Okay.
When
diarrhea during the menstruation.
Yeah. So in non-period time, she would have constipation, but when she comes to menstruation, she would have a lot of diarrhea.
Okay.
Abdomen easily feel bloated, and a lot of sometimes occasional cramp in legs and on the leg,
Okay.
tired, fatigue,
Okay.
and feeling thirst, constantly drinking a lot of water,
Okay.
and frequent urination. And also she couldn't endure hunger. That's the problem.
So whenever she's hungry, she have to eat right away.
Yeah. Otherwise, she will feel very weak, have a little bit shaky hand and cold sweat. So those are signs, that very typical sign of hypoglycemic, right?
Okay.
It's very common, and it turns out.
Okay. What did you find out?
So it turns out that she recently diagnosed with hyperthyroidism.
What is that?
Hyperthyroidism is the thyroid function being hyper.
Oh.
Right.
Okay.
So she used medicine for about 10 months.
10 months.
10 months, and so we see that in 10 months that the painful menstruation becoming worse. She had
before she used the medicine.
She had painful menstruation before, but over the years been toning down.
Okay.
She's been relatively fine.
Okay.
Insignificant, but after 10 months hyperthyroidism medication,
okay,
for the past few months, the painful menstruation actually come back.
Okay.
So let's look at the eye exam.
Okay.
What we find is that the liver has building up some toxin. Okay, right here.
What is that?
The toxin from medication.
Oh, okay.
Yeah. And stomach has some slight inflammation.
Okay.
And look at this. The heart is a little bit straining, and that's part of the reason that she feel tired.
Okay.
And we can see that the iris is look kind of pale, so that indicates that the blood circulation is kind of low.
You mean the uneven color?
Yeah, the uneven pigment here.
Okay.
Yeah, so here's darker, and here's lighter, a lot lighter, significantly lighter. So indicates that the blood circulation been kind of low. And here's the toxicity is building up in the edge here. So there's a stain. Here's the stain that the stain surrounding the iris indicates the the toxicity building up in the liver, which most likely from the medication she used for the past 10 months.
Oh, I see.
Right, and slight stomach inflammation.
Mm-hmm.
Okay, so a little bit purple. That indicates that the heart doesn't have enough, oxygen supply. So it looks slightly purple.
Okay, what is the line down there?
Small intestine get affected.
Okay.
So that's how she got constipation.
Diarrhea.
Constipation in non-period time and diarrhea in period time. And you can see a lot of dot here, slight dot, all over. So that indicates the circulation has a little bit stagnation, which means that the blood's kind of thick.
Oh, the little dot.
Yeah, the little dots here.
Okay.
Okay, so to sum it up, we have a painful menstruation and nauseous, even vomiting, and also a lot of diarrhea and painful abdomen, very light very light bleeding.
Okay.
So it appears to me it's a sign that we call that chronic deficiency. Chronic deficiency is a very commonly seen syndrome.
It's very general, though.
It's very general. It could manifest in many specific diseases, such as hyperthyroidism, hypothyroidism, and even the tuberculosis, TB, even the HIV, AIDS. Now, all these, is actually a manifestation of chronic deficiency.
Okay.
So, so there's a solution to it. The herbs we use includes things like angelica, cinnamon, and peony, licorice, ginger, and dates, and malt. Malt is a sugary gel that we use to help a lot of stomach condition.
Oh.
The whole recipe is actually very tasty, delicious.
Tasty?
Yeah, it's actually very good.
Okay.
Right.
A lot of people, they don't like the Chinese medicine taste, but this one actually is tasty.
For any kind, for people who has deficiency syndrome, all the herbs we use got to be sweet and tasty. And for the detox herbs, those herbs doesn't taste very good, right?
Oh, okay.
So that's the general rule here. Okay, so here's her first visit. We're gonna see that the follow how she goes with the herbs, but I think it's gonna be worked out very well for her, because I've been seeing that over and over.
Yeah, that happened to a lot of females.
Yes.
Okay.
So that's it. Yeah.
Thank you.
Mm-hmm.